Hello and welcome back to Doing the Most with me, Cynthia Mallard. So happy that you all rejoined me again for Doing the Most, right? Are we doing the most with the time that we have left? Are we living to inspire, right? To change someone else's life. That's what we do here at Doing the Most. I want to say we are celebrating the amazing women for Women's History Month. Now, you're fabulous. I'm sure you know a woman that's absolutely fabulous and doing the most. So listen, you've got to tune in right here. This show today is an amazing one. I am going to bring you one such fabulous woman. Let's see if we can get her into view. There she is. Everyone, welcome Shana Scott to Doing the Most. She is the Vice President of the American Heart Association Health Strategies Wing. Gotta say, welcome, Shana.
Thank you, Cynthia. Thank you so much for that warm introduction. It is a pleasure to be here and to be with your audience, and I'm looking forward to our conversation this morning.
Absolutely. Like I said, we are spotlighting amazing women who are doing the most to change others' lives. It's kind of like what we do, right? And so I was just telling you off air, I met you guys, I met her during just a wonderful CPR instruction, training, learning session with my sorority, and found out, guys, like she is a plethora. When I say she is a walking plethora of information that you got to get into. You got to get into it. So I just want to, Shauna, I just want to run down, and I hope it's okay with you if I could just kind of run down some of the things that you are responsible for and have done. Again, I said she's a VP, American Heart Association. She's an attorney, guys. Working behind the scenes to affect public health. She served as Director of Compliance for Barnes Healthcare Services. She also, guys, she worked in the chronic disease prevention at the Georgia Department of Public Health, okay? You got your JD, right? JD from where again? Tell me about
Loyola University Chicago School of Law. So Midwest Law School, and, working in public health and public health law. And I feel like, what I do is like the embodiment of your podcast, because I be doing the most, Cynthia.
You absolutely do. Let me tell you, I ran all those accolades down because this episode is about women who you do so much, right? You do so much. Your brain, you're pulled in so many different directions, but you do it flawlessly. And you're in the area of public health. Give us an idea of kind of what you do. What's your day like?
Oh gosh, what is my day is different every day, and so is what I love about public health. Like this morning, before I got on with you, I had an interview with the AJC to talk about health disparities and the social determinants of health, and what does that mean for Metro Atlanta, and talking about data. So I spend my time reading articles and being caught up on the literature of what's happening when it comes to health and health policy. I also then work with my team around strategizing. When we think about Metro Atlanta, there's 11 different counties in Metro Atlanta, and they're all different. Everything isn't. And so what's happening up north might be different than what's happening down south. And so I have to be able to strategize and think critically about how do we impact the health of all of those different diverse communities. Not everything is the same. And so coming up with ideas and thoughts and strategies. And then I may come home, and I have two children. I have a college freshman and a first grader. And so that's different. It's two different ways of thinking and two different, and so taking care of a home. And then I also teach at the University of Georgia. So then I have to put on my teaching hat and understanding policy. And so my day is different every day. Every week it's different, but for the most part, I try to make sure that I'm keeping my finger on the pulse of health and health and I know what's happening in DC, and I know what's happening in Georgia, and how do we impact the lives of Georgians?
You know what? It's so, I love that you say impact, right? That word means so much. In today's society, we are still in post-pandemic.
Yeah.
I want to start off by asking you, in your work, in your everyday, what is the public health issue that is number one on your docket?
Oh, goodness. There isn't a number one thing. For me, it's understanding the social determinants of health. When we talk about the social determinants of health, I'll break that down for your audience. It's probably a term that they've been hearing a lot because of the pandemic, but
Mm.
not quite sure what it means. And so the social determinants of health is everything else that we can't control that's impacting what our health is like.
What can't we
So
control?
we can't control it. We can't control racism. We
Mm.
can't control the communities that we live in. Um, but we can control what we do. We can control our behaviors, right? We can control our hypertension if it's not familial, right? We had talked about that a couple weeks ago when I met you. We can
Yes.
control some things, but those social determinants of health, having access to nutritious foods, having access to quality housing, having access to public transportation. Those are not things that are in our immediate control, but they are in the realm of our control in a little bit. When we exercise our right to vote, when we exercise, our political prowess, when
Yeah.
we lobby, when we beat down the doors of our mayors and our elected officials, right? And so the thing that's on the pulse of what I'm always thinking about is how can I get into a community, talk to community members about ways that we can resolve these systemic issues. Systems change is what I do. And so working in that way and not just about one issue, because public health and the health of individuals, it's not about like only about what they eat and exercise and diet, but
Right.
how do we allocate dollars for transportation? How do we create sidewalks? How do we ensure that our kids have access to green play spaces?
It comes down to the money. It comes down to the resources. I remember just covering the Alabama legislature, and I just remember it came down to the resources. Who's getting the money? Does the money go into the more affluent area? When you know that this area over here is underperforming, is low on the socioeconomic scale. Who determines that? So you're the person who goes in there, right? Am I correct?
Yeah, that is all a part of the work that I do, and being in community, talking to community members about the ways that they can do that, but then talking to those elected officials to ensure that they understand what the priorities are in the communities. Because as an elected official, you may have a district, but you don't know everything that's happening, and
Right.
where you live may
Right.
not be representative of the areas that may need the most help.
Yeah. Tell me, Shanna, how long have you been doing public health work and, kind of, yeah, kind to bring equity across the board? How long have you been in the business?
I graduated from public health school in 2004. So it's almost 20 years, 19 years and counting. I have been in public health, and then I added the legal and policy side about 10 years ago because when I was doing my work, I was more focused on like the behavior change and telling people to quit smoking and doing all of these things. And I'm like, none of that really, it matters.
Yeah.
But if we don't change the systems, then it doesn't matter if we have behavior change. It doesn't matter if we tell someone to eat healthy, because if they don't have access to a grocery store, or if they don't know how to apply for food stamps, or we've seen with the pandemic,
Yeah.
food stamps, like articles have been coming out this week about the cuts to benefits. And so if we don't talk to people about the policy changes, then the behavior changes won't really matter.
Tell us, give me your initial thoughts, for those, like I said, we have audience members who, food stamps, it's a matter of life and death, right?
Yeah.
It's a life of survival or not. Give us thoughts on that.
Yeah, the articles have probably been coming out this week about the cuts in the benefits, and I will the post pandemic benefits, and I will say it's devastating. And so the that is a federal issue, but there are ways that we can work around it locally, where you can have your counties can allocate dollars to double bucks. So let's say if your benefits were, you went from 400 a month, if we had the option to double our bucks, now you can, if you had $10 to buy some fruit this week, you can still get $20 worth of fruit for $10. And so double bucks is something that you can do locally at the county or city level, where they can allocate dollars in the budget for those things.
Wow. When we hear this, and Shana, I will tell you, your audio is a little low. I think you kind of dropped out a little bit. When we hear about that, like I said, the normal, ordinary, everyday person who's not down at the legislature, who's not at the council meeting, explain to us, like, what can we do? We are a person who's being, affected by, these benefit cuts that affects directly our public health. What do we do? What can we do?
You know what? Unfortunately, you can't appeal, right? Typically, when your benefits are cut, you can go through the appeal process. But with this cut that is taking place, you can't appeal. But what you can do is directly to that person that you're buying from, you can ask them about double bucks. And now they have the power, right? Because they're the ones taking the food stamps. So you can ask your local grocery store or your local farmer's market or your local food stand that takes food stamp dollars. You can ask them about doubling up, and then they can push forward and be the advocate on your behalf.
Wow. So we're talking about nutrition. We're talking about equity in food. Talk to me, Shana, about what's the biggest pushback that you get? Because I can imagine in this type of work, it's not easy by any means.
Yeah, pushback, and I hate to talk about pushback because there's always a workaround, right?
Yeah.
And I'm very persistent. I think pushback often comes just saying it's not in the budget, it's not a priority. Anything can be in the budget, right? We can find dollars to do anything, and we can make anything a priority. From community members, I think pushback often comes when it comes to trust. And, we study our communities over and over again, right? And you have researchers and scientists come into quote unquote poor communities or under-resourced communities and want to study them and research them. And so there is that trust, mistrust. But I like to hire teams that look like me. I like to hire people. And even before that, which is why I'm in faculty work, I'm encouraging students who are in undergrad to do this work. So go in community and talk to people who look like them so that we can build up trust, so that vice presidents and public health directors are people of color and men and women who look like the communities that
what, I'm so happy that you touched on that, because I was just getting ready to ask you, Shana, does it matter that you're a woman, that you are Black in this arena? Does that change things for you, or have you seen that? Obviously, when I started in journalism like years ago, it has changed a lot, and it means something to me. But what about you in the work that you do?
I think it definitely means something. It definitely means something for me to go into a neighborhood and say, I'm the vice president, at the American Heart Association. It lowers some walls, it relieves fear, and then I'm gonna talk just like you. I probably will have my braids in, I'm gonna look
Absolutely.
like you. I'm gonna have some gaudy jewelry on, and so we are going to relate to each other. And my degrees to me don't mean anything if I'm not able to use them.
Hold on, stop, Shana. Roll that back. Did you guys hear that? If you are just joining, doing the most, did you all hear this? This is the vice president of the American Heart Association. Run what you just said back about your degrees.
my degrees don't mean anything if I'm not able to do the work that I paid for them to do. If I'm not able to go talk to my neighbor and say, how can I help you? You know, what can I use this JD to do? I didn't go to law school to be a lawyer. I went to law school to help people.
Wow, amazing. So, Shana, we talked about, like I said, we talked about one aspect of public health. You also deal with housing because that's a super big issue that we are dealing with right now. Also, talk to me about where we are in fair housing and how that affects how you use what you do to empower people.
Yeah, when you think about public health, right, people don't often think about housing, but when you're looking at the social determinants of health, you have to, because I can't come and have a conversation with you, Cynthia, about healthy eating and nutrition and physical activity, and you have mold in your house, or you can't pay your rent, right? I have to think about all of the situational things that are happening
Or
in your
safety.
life.
Right.
Yeah. All of the things that are happening in your life that can prevent you from even making that basic decision, because how priority at this point. So it's very important when we talk about fair housing and affordable housing to create more affordable housing so that families, women who are leading families, men who are leading families can not have to worry about housing when they have other basic needs that need to be met.
Absolutely. And when it comes to fair housing, again, how do we get involved? Like how do we change it? How do we change the narrative?
We change the narrative by, I hate to say this, it sounds very cliche. It's going to be about voting, right?
I'm sorry, about the what?
About voting. When we think about our housing stock and our housing market, we are seeing what we call legacy residents being pushed out because the housing stock is increasing or decreasing. Yes. And we are building at such a fast rate, and pricing is increasing with that rate that we're building. And so a legacy resident may be an owner, but now they have taxes that are well beyond what they can afford. And now they may lose their home as a result of not being able to pay taxes. And so this is all a political issue, because this is determined by who's on our city council, who's on our county commission, and so what can you do? Create coalitions of your community members, and it doesn't have to have a fancy name. You and 10 of your neighbors get together and stalk those city council, county commission meetings and talk about your issue over and over again until you get the attention of the people that are sitting on that bench that are going to make that change in that regulation or that law.
Absolutely. If you are just joining us, again, we are talking to Shana Scott. She is a VP with the American Heart Association. She wears so many different hats, and sometimes I get kind of confused. Okay, which hat do I need to talk about right now? As a I know you, as a Black woman, I'm a Black woman. Our health is pivotal. I always say, and you always hear it, health is wealth, because, you can't get out the bed, right? Forget having a job and being mom and being the superwoman, right? If your health is headed down. Talk to me about the health issues that we as women should be looking to change.
Right. Well, we know that Georgia is number 48, maybe 49, maybe 50, depending on the day of the week that we're talking about when it comes to maternal health, meaning that we are at the bottom, the bottom when it comes to maternal health, meaning that women are dying either during childbirth, postpartum, within, several months or up to a year after giving childbirth. Some of it not because of anything that they've done. There are risk factors that could increase that, but we have women that are dying because they don't have access to prenatal care. They don't have access to providers. Racism, they are not believed when they say that they are in pain or that they're experiencing something either during childbirth or post-childbirth. So there's that. When it comes to the leading causes of death for women, we know heart disease is one of the leading causes of the number 3 leading cause of death, not just for women, but Black women as well. We have our cancers, that's not my area, but cancer, diabetes, our chronic diseases in general are the leading causes of death for Black women.
Yeah, we always hear comedians, right, joke about, mama got the sugar, or uncle had the sugar and that type of thing. And of course they are talking about diabetes, right? I heard someone say diabetes is an epidemic. I know that my mom, she was diabetic. She was insulin dependent. And I have had so many people in my family. Diabetes is hereditary.
It can be, and so can hypertension. But for those who are not genetically, which is why I said that familial earlier, who are not familiarly to hypertension or diabetes, you can prevent diabetes and hypertension if you maintain a healthy diet and increase your physical
activity. All right, now, Shana, listen, you said making it healthy. We get it. So what do you mean? You had that look on your face like, here she go. What does that mean?
Maintaining a healthy diet.
Healthy lifestyle, a healthy diet.
Are we going to be real, Cynthia? Are we going to be real? We need to cut out the fast food out of our diets. Okay?
We can't have what? Like a hamburger?
I'm not saying you can't have it, but you can't have it every day.
Right.
We need to, I'm gonna hide my face before your audience throws tomatoes at me. We need to reduce our fried food intake. I'm not saying you can't have your fried chicken, but we need to reduce that. Or reevaluate the preparation options. So how can we fry our chicken, but fry it healthy, right? Right? How can we have our mac and cheese, but make it healthy? And there are recipes out there.
Yeah.
Y'all, you don't need I've seen some things on Instagram with all the butter and the sugar. You don't need the 10.
But it tastes so good, Shana, though. It tastes really good.
And I'm not going to say that I don't eat it, but I don't eat it all the time.
Absolutely.
Right. And so even if you are eating those things, right, get your fried chicken. I'm not knocking what anyone eats. Get your fried chicken, get your mac and cheese, but put some green on your plate.
Yeah.
And not the collard greens that's been cooked for 2 days, right? Get some fresh green on your plate.
Yeah.
A small salad. Put some fruit on your plate, not the fruit that's smothered with honey. Fresh fruit.
Yes.
And a small salad, and I will give you a thumbs up.
You heard it here, guys. You heard it first. You heard what Shana just said.
They threw the tomatoes at me, though. They threw the tomatoes. Keep those tomatoes over there with your red background.
Okay, absolutely. So you heard it here, guys. You just gave us a plan to start our healthy eating, right?
Yes.
And it works.
It works. I'm not saying that, there needs to be like a fad diet and you need to lose. I didn't talk about the physical activity. We can get there, but it's about maintaining a healthy diet with things that are live foods, live vegetable, So let's say, we talked about SNAP and all of those things earlier, so I don't want to be contradictory.
Yeah.
And we talked about access. So you may not have access to the fresh fruits and vegetables all the time.
Mm-hmm.
Frozen is a great option.
Yes. Versus over cans, right? Is what I heard.
That's exactly what I was going to say.
Okay.
So when we talk about a healthy diet, okay, you may have your canned stuff. Let's try to eliminate those things and replace them with the frozen if you are not able to access fresh.
I want to ask you, because like I said, I know we don't have much time. Again, I mentioned earlier about, you know, we're in the post-pandemic, right? What do you hear now? You know, are we still, do we still need to be worried? You know, is the mask something that we all need to be masking up? You know, are we clear? Are we headed to, you know, being clear?
I never say that we are post-pandemic. I do subscribe to the fact that we are still in it. We will not be post until we see those numbers are low to non-existent. So for me, I am not President Biden where I'm saying that the pandemic is over. I still follow the precautions that were provided by the CDC. And so I do mask in public places. I'm always going to wash my hands regardless of the pandemic or not. So I maintain, you know, my cleansing hygiene. And if I'm going to be in a place where it is not people I'm in contact with on a day-to-day or a weekly basis, I do still wear my mask.
So can you give us any numbers when it comes to COVID and kind of where we are?
I don't know the data off the top of my head, and it is county specific. I know that our Georgia numbers are stable right now, meaning that we are not in elevated crisis, but it is, we are moving out of the winter months into the summer months. And so I think we will see our numbers getting a little bit lower again. Once we are flu season, I think the numbers should also, we're also, flu was very hard this year as well. So flu coupled with COVID, coupled with RSV, were all problems that we saw. And I think we should see some stabilizations there.
Yeah, I wanted to ask you, Shana, like I said, you have, I mean, really blessed this show, doing the most just with this amazing information. I have to ask you about you, Shana. Like, what are some challenges that you care to even tell us about that can help inspire the next public health director because of what, you know, she heard you or he heard you talking about this? What is it, something that you had to get over to even make it to this point?
I think that that confidence, you know, earlier in my career, I would be in rooms and be silent and not speak up. And I think it took time and confidence to say, you know, I'm in this room for a reason. And so if you are in a room, know that you were invited there for a reason and use your voice. And so I would say that was one of the initial qualms that I had. I would also say time management, trying to do the most with the little bit of hours that are in the day. And so burnout is real, and stress on our bodies is real. And so making sure I take time for myself too. And so that would be a recommendation, ensuring that you are carving out time for yourself. Because here's the thing, there's another Shana waiting to take your spot. And so that job will find that other person if you are not performing, if, you know, for any reason. And so take your time, use your time, because it's all that you have.
It is all that you have. All we have is this time, right? And we get one go at it. You know, I like to think about in my profession, Shana. Shana, I remember, you know, someone had a medical emergency at the desk of directing, and they had the medical emergency, and kid you not, that person was moved out of the way. And the second person had to come in and subsequently took the job, but they didn't stop the television, right? They didn't stop and say, oh, we need to go to, you know, commercial, we need to shut down the station. No, the ball continues to roll. When one person can't do it, a lot of times we hold on, right? We hold on to things because we're like, I am the only person who can do this. No, there's 1,000 other people who can. I love that you said that.
Yeah.
I love it. Shana, I just want to tell you, well, before I get to that, is there any way that we can contact you? For those who want to talk with you, maybe they're lobbying, maybe they're lobbyists, maybe there is just a grandma or someone who wants to talk with you on these particular issues. How do we get in contact with you? Give us a contact.
I think I'm on all the socials, so you can find me on LinkedIn, Shana M. Scott on LinkedIn. And then the socials, Instagram, Twitter, it's Shana Medika, Medika. I'm on both of those, and you can find me posting smoothie recipes and exercise regimens and things like that. And on Twitter, I'm tweeting about microaggressions and social determinants of health and all of those things. So yeah.
Very cool. Well, thank you. Thank you so very much. Again, Shana Scott with the American Heart Association. She does so much, and she's off to another meeting right after this. She's had so much. So, guys, if find the time, if you can find the time to actually get at her, because it could, the information that we try to bring you here, that we try to empower you with, we try to inspire you with, right? Something to help you get off the couch, right? I'm very guilty of that, Shana. I roller skate.
Oh, that's awesome.
Yeah, all of us
I didn't have two left feet.
I kind of try to roller skate every single week, but I'm also eating. So I just love what you said to me and to our audience, and just everything that you're doing. I just want to say, happy Women's History Month to you.
Thank you. You too, Cynthia. This was a pleasure. I definitely chatting with you this time.
Well, very good. And and then the last thing I want to say to you, Ms. Scott, is Shana Scott, you are doing the most with the time that you have here. It's now time for Doing the Most in Action. Really just an amazing part of the show that I feel like, hey, I'm hoping and praying that it will change, elevate our lives. So today's Doing the Most in Action, right? Can we be real? Can I just be very, very transparent and just be straight up with you, right? Why are we afraid to fail? Why are we afraid to go after the thing that we really want the most, right? I'll tell you why. Again, we are afraid to fail, right? I think a lot of times we get in our heads, right? And we're worried about what other people think and what they would say about us, and how we feel about how we're perceived in other people's minds, right? We gotta throw that away. We gotta throw that away. We have to think about, wow, I was born to be an author. We got to think about, wow, I was born to be a doctor. I was born to be maybe a translator. I was born to be a healthcare worker. We've got to think about those things, right? And we have to throw the fear away. Yes, I hear you. You're like, Cynthia, that's easier said than done. I agree. So how do we tackle that? I'll tell you. For me in my life, I was just like you. Just like you. And then I find myself times, even now, guys, like, I don't know if I should do that. What happens if it doesn't work out? I'm here to tell you, what if it doesn't work out? It's okay. It is okay. Because my whole thing in taking risk and trying things, right? Guess what? We get a do-over. We get a do-over. So if you try something, it doesn't work out, exactly the way you planned, right? We learn from what we did, and then we go forward. We try something different. We kind of recalibrate, right? So listen, throw out the fear of failing. Hey, you've heard this before, and I'm going to say it again. Failing or maybe, going through something that you didn't expect, it's all part of the process. It's all a part of the process, right? Then you look back and you're like, man, I'm glad I took that risk, right? I'm glad I got rid of that fear, the fear of failing. Think about all of our super, super successful people that we know, that we look up to, right? That we want to be like, that we want to emulate. They've gone through what? Hundreds of different initiatives, different inventions, different careers, until they found exactly the one thing that was made just for them. And woo, it took off. I am not afraid to fail. Just say that. Let's say that right now. I am not afraid to fail. So if you are the next big author, you are the next big train conductor, whatever it is, right? I always say this, small steps. Go ahead and write in that journal, you author, right? Go ahead and enroll, attempt to get into medical school to be the next big doctor. Yeah, whatever it is, don't be afraid to fail, right? If it doesn't work out the way you planned it, trust me, there is something else waiting for you. Redirection, right? Yeah. Doing the most in action. I love you. Thank you so very much for tuning in every single week. Listen, don't forget, you got to subscribe. You get all of the content. Doing the most in action. You get the amazing people that we bring to you every single week, who are working to inspire and leave this world a little bit better than how they found it, right? That's what Doing the Most with Cynthia Mallard is all about. And I'm glad you are riding with me, okay? Again, you can catch me and the show and all of our content across all social platforms at Doing the Most with Cynthia Mallard. But you also, you can reach me, guys, at Cynthia Mallard across all social too. So you can get at me. And then, of course, you can do Doing the Most Life at gmail.com. And, of course, hear me talk at gmail.com. Again, I love you. And always, always, always do the most with what you have. I'll do the most, you do the most.